The budget process in Kenya holds the promise of progress and development. Yet, beneath the surface of optimistic figures, the reality more often than not paints a starkly different picture.
National and county governments have accrued pending bills that almost add up to 700 billion shillings.
The Public Sector Accounting Standards Board is warning that failure to pay the pending bills poses a major threat to the economy.
That money is always disbursed. Where do all these people emerge? Why are people who did services not paid?
Wherever it is that the money goes, it doesn't go to growing the economy, not really.
Yes.
God alone knows where it goes.
Kenya faces significant hurdles due to fiscal accountability challenges such as mounting unpaid bills and poor absorption rates, issues that have the potential to disrupt the country's economic growth, hinder efforts to improve the livelihoods of Kenyans, and seriously threaten the country's economic stability.
Because of it, the money which would have turned around to drive the wheels of development is been locked. So the wheels of development is actually being retarded.
Kwanza niseme huku kwetu ni kama tuonangi kama ni Kenya, kwa sababu ukiangalia barabara benye hiko ni kuhatarisha maisha ya wananchi.
Ndawa ni hiyo ya kuumu haina, ndipo tulikuwa tukienda huko Eshiala, lakini tunaambiwa hiyo dakika kwa sababu hiyo nyoka ilikuwa na sumu mbaya sana.
In this documentary, we look into how fiscal accountability impacts service delivery in the very fabric of Kenya's development.
Imagine a world where money that has been allocated to a project is actually paid to all the elements of that project. Imagine, it's like walking on rainbows and eating gold dust.
And the project is executed as per design.
It's like you're living in heaven.
In a meeting chaired by President William Ruto at State House, the cabinet noted that pending bills remains a sticky issue. The national government pending bills since June 2005 to June 2022 stood at 481 billion shillings, while counties owe 159.9 billion shillings.
This menace, running over the last 2 decades, has resulted in lost opportunities for the people of Kenya, the businesses of Kenya, and the entire economy of the Republic.
In September 2023, the National Treasury gazetted a committee to verify pending bills owed to suppliers by government entities from 2005 to 2022.
First, there is the issues of contracting, the process of procurement. Then there's the issues of bad governance, or what you say, the interests of the people to make money. A lot of pending bill tends to be put over from change of regime. So every 5 years this happens, and it accumulates. But apart from that, there is other pending bill which are just due to, people are not being fair, not being transparent, and not paying those who really did proper job, rather than preferring those who have paid something.
As of January 30th, 2024, the Pending Bills Verification Committee, chaired by Edward Ouko, Kenya's former Auditor General, had received 1,537 claims from 38 ministries, departments and agencies amounting to 145.5 billion Kenya shillings. These claims included 309 for goods, 945 for services, 1,195 for works, and 2 for labor.
When we are holding this money from the suppliers, who is responsible? Because there's no institution like a governor. There's a chain. There's someone who is personally liable. Yeah. At what point do these people who are personally liable, at what point will we get these people to be
accountable for their actions?
Pending bill is a legitimate problem, but it is also at the heart of corruption. Because every new government comes, brings their suppliers who are not supposed to do anything. They're supposed maybe to recoup their political, the money they invested during campaign or their political capital. So they don't deliver. So these are the things we are dealing with when we say we want fiscal discipline, budget discipline. And governors, ministers are summoned. Have we gotten any action? Not quite.
The struggles suppliers face to get their dues after delivering goods and services highlights a lack of accountability that extends beyond their immediate impact. This disruption hampers government operations, discourages private sector engagement, and ultimately stifles economic growth, with negative effects rippling through the entire economy.
Right now, also, a number of people, genuine people, don't want to do business with the government. And that's wrong. I mean, government is the biggest employer, the biggest spender, and the biggest source for private business. So if a lot of people, genuine people, don't want to do business with the government, the consequences are grave, because a lot of people the economy cannot move. Do you understand? As the multiplier effect of government spending is part of the economy growing our GDP. Okay, so those are some of the consequences. In other words, we are really not realizing our potential growth.
We definitely are aware now that we are struggling with budgeting. We are over ambitious in how we will get revenue, both tax revenue and debt revenue. All the money we are collecting in taxes is going to repayment of debt. Very little money is left for essential social services.
An analysis of oversight reports from the Office of the Controller of Budget and the Auditor General by the Institute for Social Accountability and the Institute of Economic Affairs identified two major fiscal accountability issues in the 2022-2023 fiscal year. These include a large number of unpaid bills at the national level and low absorption rates, meaning that a considerable portion of the allocated budget went unused, particularly in the health and education sectors.
So ministries like the ministries of education at the national level, increasingly, especially in that year, faced very low, very delayed disbursement of money that resulted in low budget absorption. That the money takes so long to get to schools. What does that mean? It means the school changes the mode of operation and parents must keep paying to supplement for the government failure to disburse money. I doubt anybody can right now say we have free education, basic education at primary and secondary level. But even in this particular budget policy statement this year, counties are facing budget cuts. Now, it does not end there. County disbursements are they come between 3 months to 6 months late. That results in a situation where counties have overdrafts that were used to just pay salary. As a result, hospitals that are run by counties, they have no facilities. They have no electricity. Some places, I think I went somewhere and I was surprised to learn the hospital had no water. As women were being admitted, they had to bring water to a maternity ward. That is how dire the mismanagement of the budget process is. That's the effect.
The accumulation of unpaid bills and low absorption rates are crucial issues within public financial management. Every shilling tied up in unpaid bills signifies key infrastructure and services that are not delivered that could improve the lives of millions of Kenyans. In a country where basic services are lacking, this negligence carries consequences that extend beyond financial figures. In a humble homestead tucked away in Kandongo area within the Raka Ward, Kitui County, more than 250 kilometers from Kenya's capital, a family gathers outside and unites in a song. Judith Kawera stands amidst her loved ones, but she carries a weight that no words can express, a mother's grief.
Hiyo nyoka kumuuma, niliuliza Mungu, afadhali ni mimi nilikuwa nikiuma, kwa sababu huyu mtoto ni mchanga, ni mtoto mdogo sana.
Her daughter, Nancy Mukami, once a spirited 11-year-old girl, now lives on in the hearts of those who knew and loved her.
Aliumwa hapa kwenye kopo, hiyo. Ameumwa hapa na hapa. Naona hiyo inaitwa ndakame, ndamu.
On 20th October 2023, as Judith's home burst with warmth in the company of family and friends, trouble would soon darken their doorstep as the night crept in.
Ilikuwa kwa kuku hapa, alafu nikasikia mguruma wa ile kuku ikipiga nduru. Nikamulika, nikafungua hiyo nyumba. Mahali nimefungulia haikutokea hapo, imetokea mahali pengine. Ikaenda kwa nyumba, ikaenda mpaka ikifika hapa kwa mlango, ikapanda mlango, ikaingilia hapa juu, ikaingia ndani, ikakuta mtoto alikuwa hapa. Walikuwa wawili, mmoja kaumwa, mwingine akaachwa. Akiumwa hakuwa anasikia. Nikimtoa nje ile ananiambia ameumwa. Nikamwambia wacha nitoe wale wengine nikuje nione. Nikamaliza kuwatoa, nikamkuta ametoa njazo akiwa pale nje.
Kama masaa ya saa 5 hivi nilisikia huyo mama akinipigia simu, akaniambia ati mtoto wake ameumwa na nyoka.
Nancy suffered a black mamba bite, one of the deadliest snakes worldwide. The symptoms of a black mamba venom have been reported to occur within 10 to 15 minutes after the bite, and without urgent treatment, their bites could be fatal. Jonathan Kimwere, Judith's brother-in-law, and his wife were the first to respond to her call for help.
Hiyo mtoto tulimbeba na mgongo kama mtoto mdogo. Tukambeba mpaka huko kwa barabara. Mmoja akimbeba kishoka, huyo mwingine namchukua na mbeba. Hiyo ndio hali tulipitia mpaka kwa barabara tukapata gari.
In the face of a health emergency this critical, the closest facility equipped to treat a snake bite, according to the family, was Ishera Level 4 Hospital, situated approximately 50 kilometers away in Embu County.
Hakuna hospitali zingine ziko huku tunaweza saidia kama mtoto akiumwa na nyoka ama akiwa amegonjeka sana, tunawapelekanga watu huko mbali kwa sababu ya huduma. Kwa sababu huku kwetu tukiangalia hakuna huduma mzuri.
The Kenya Master Health Facility List, a comprehensive registry of health facilities and community units nationwide, records approximately 521 facilities in Kitui County's 8 constituencies. Mwingi North, where Judith and Jonathan are from, hosts about 61 of them, and zooming in further to the Raka ward, where they live, we only find 4 healthcare facilities.
Budget ya serikali kuu ikisomwa, tunasikia Ministry of Health imetegwa kiwango kubwa ya pesa. But my friend, ukija ground unapata story ni tofauti.
Gabriel Nyamo serves as a community health promoter, previously referred to as a community health worker in Kandongo area. The basic healthcare, wellness, education and services he provides are crucial for the welfare of his community. However, the harsh realities on the ground present a significant challenge to his efforts.
Hapa tuko sasa, tuko karibu na Ndangai dispensary. Unaenda daktari anakuambia kuna dawa. Unaenda Champion Center, unapata hakuna dawa. Pale hata kumekuwa na ambulance imesimama pale kwa mwaka sasa na almost nusu. Haina driver, haina mafuta, ukiuliza unaambiwa hakuna budget ya kuweka hiyo gari mafuta, vitu kama hizo.
People that are bordering our near counties, that is in some areas like Kitui Rural, Kitui South, Mwingi East, Mwingi North, Mwingi Central, those people, they opt to go to other counties because in those other counties, you will find that the facilities are staffed, they are not closed. Number two, you'll find that the commodities are there. You'll not be told to go and buy this or buy that. Number three, you'll find that you will get all what you need in one facility. Our number one priority in those facilities is to save lives. So it is a traumatizing thing to get a patient and you can do nothing.
Dario, not his real name, grapples with the feelings of being powerless amid the challenges of being a doctor in Kitui County. But the limitations of his working environment come with another struggle, a battle against a system that often fails those in need.
When you look at our budget as a county government, you realize out of our resource envelope, we are talking about 12 billion, our annual budget as a county government. You realize in the range of 3.5, 3.6 billion goes to healthcare. Tuambiane ukweli, counties are unable to manage healthcare. And one of the reasons is we also cite corruption is inadequate funding. If you took the entire resource envelope of Kitui County government of 12 billion and put it in healthcare, you will still find gaps. It is a phenomenon we're experiencing in the entire country. If it was specific for Kitui, then you will say there is something wrong happening in Kitui. As much as there is, I'm not saying there isn't, but the issue of funding is affecting county governments in all the 47 counties.
The budget itself is defined when it is approved into what you call a recurrent expenditure and development expenditure. So that it is expected that at least 30% should go to development and the 70% goes to recurrent. So the 30% is really where the reports say we are not using. We expected that a lot of the money, at least 30%, should go into delivering all this, delivering devolution to the ordinary person, and that means delivering the services, in creating development in a general sense, and making sure that our well-being are uplifted. So you really have a lot of problems at the health side because suppliers of drugs have not been paid, doctors have not been paid. And so there is, the pending bills is even the fact that we now have these CBAs and you have committed to it and you're engaging people and you're not paying. So all these are coming to be pending bills. Those are the consequences.
On 14th March 2024, Kenyan doctors took to the streets demanding the implementation of promises made in a 2017 labor agreement involving the Kenya Medical Practitioners, Pharmacists and Dentists Union, the national government and the 47 county governments. The agreement aimed to address ongoing issues within Kenya's healthcare system, including better working conditions, salary increment and the recruitment of more doctors.
Have we seen the judges getting a pay cut? Have we seen the CSs getting a pay cut? So why pick on a doctor to get a pay cut and unilaterally push it down their throats?
We are hired help. It's not our job to resolve the health crisis in this country. We are available, we shall work, but on our terms.
If any persons die in the hospitals, or if they fail to get the health care, the problem squarely goes to the government.
In the last decade, Kenya's healthcare sector has seen frequent labor disputes due to unfulfilled demands of healthcare workers. Despite signing the Abuja Declaration of 2001, which urged African nations to allocate 15% of their budgets to healthcare, Kenya has consistently fallen short of this. Moreover, there's a significant shortage of doctors, with only 2.3 for every 10,000 people, far below the World Health Organization's recommended ratio of 1 doctor per 1,000 people.
We have around 14 sub-county hospitals. Kitui County has more than 300 facilities. I started by saying that every dispensary has one nurse. Every health center has one nurse and one clinical officer, or a maximum of 2 nurses and 1 clinical officer. So in level 4 hospitals, you get one doctor, 2-3 clinical officers, 7-8 nurses. That is not enough. Every dispensary needs at least 2 nurses. Every health center needs at least 2 clinical officers, at least 5 nurses. Every level 4 facilities needs at least 2 doctors, 10 clinical officers, at least 20 nurses. And for the busy facilities like Mwingi and Kitui, we talk of bigger numbers than that.
The sight of doctors protesting on the streets, for instance, may seem like a neglect of their duties. However, behind their demands are actual implications of the challenges in the health sector on ordinary citizens whose lives hung in the balance.
The antivenom is not supplied to all the level 3 facilities. None of them gets the antivenom. Yet that is what is happening. The level 3 are the ones that are on the ground, the health centers. No level 3 facility in Kitui County gets antivenom. And you'll find that the antivenom is only supplied mostly to Kitui level 4 and Mwingi level 4. All the other facilities are not supplied. And those facilities that they get very minimum doses, such that when you go there after 2-3 weeks, you find that the antivenom is not there. Yet the issue of snake bites in Kitui County is a big issue and is happening every time.
According to the Institute of Primate Research, more than 20,000 people are bitten by snakes annually in Kenya. Some 4,000 die from snake bites, while 7,000 others are paralyzed or get other health complications. Drugs for snake bites can go as high as between 10,000 to 15,000 Kenya shillings, and a patient can need as many as 5 vials. Kitui County, like several others in Kenya, is home to various venomous snakes, such as the black mamba, cobra, pafada, stiletto snakes, among others.
Huku kwetu ni kama tuonangi kama ni Kenya, kwa sababu ukiangalia barabara venye hiko ni kuhatarisha maisha ya wananchi. Kwa sababu ukiangalia unaona barabara si mzuri, inalimwa kwa muda, na tena huku mashinani hakuna barabara zimeingia ndani. Mtu akigojeka anabebwa na kitanda. Sasa hiyo tunaona ni mbaya kwa wananchi.
Juu hata hii barabara yenyewe tumekuja nayo hapa, hiyo ndio barabara ilikuwa inatumika kukimbiza huyo mtoto aende akapate matibabu. Lakini wakati mtoto aliumia na familia ikapatwa na msiba, ndio sasa wale viongozi tuko na wao walionelea ni muhimu sana walete tinga kutoka Kitui ikuje kufyeka barabara. You can imagine hiyo barabara sasa kama ilifyekwa wakati wa kufanya mazishi. Ile siku kulikuwa na scenery yenyewe ilikuwa namna gani?
Both Jonathan and Gabriel's words hint at a painful truth. Nancy may have been bitten by a venomous snake, but her death might as well have been caused by a multitude of systemic failures.
When you go on the ground, somebody will say, health is the county government. It's not on the national government. But I hope Kenyans can get to a point where they realize those 2 levels of government are so linked, and especially when it comes to the money. When that hospital in Kitui, West Pokot, where are all these snakes, Turkana, all these areas, has no antivenom, the MP slashed the budget for counties because they knew the MP is the one who has a very big say in the division of revenue between the national government and the county government. So they can't run away from their responsibility of not ensuring that counties have enough money. So until we realize how much we must invest for our interest to be taken, our energy and time to ensure government gets their priorities right, people will continue becoming poorer. Some people will continue going deeper into lack of education, carrying a very heavy burden of disease or the process of just trying to get medical care.
Diana's perspective reveals a harsh reality where budgetary missteps have significant consequences for those least equipped to bear them. everyday citizens. When schools decry poor or lack of enough infrastructure, or the hospitals are deprived of life-saving essentials like the anti-venom, it's not just a failure of one level of government. It's a failure of the entire system to prioritize the needs of its citizens.
Watusaidie kwa hospitali wapate ndawa, na hiyo barabara watusaidie iwe nzuri, na mimi wanisaidie. Kwa maisha yangu niko na maisha masio mazuri, kwa sababu nimepoteza mtoto na niongelei.
The family's grief over their child's death is deepened by the fact that they can no longer receive compensation for snake bites since it was discontinued in 2019 due to changes in the Wildlife Conservation and Management Act 2013. This decision, prompted by concerns from the Kenya Wildlife Service about excessive compensation claims, only adds to the family's hardship. A cruel reminder that their daughter's death may have been in vain as they continue to suffer without recourse.
What I can say is an elected member of Kitui, here in Kitui County, and is a minority leader in this county assembly. We have got no reason, the county government has got no reason whatsoever to see a life lost or someone becoming incapacitated in whichever manner because of a snake bite, and the excuse becomes there was no antivenom anywhere near where that person was taken. In this era, with the ministry, whichever here is gobbling in excess of 3.5 billion shillings, talking about treating snake bites. I mean, it's a big shame. It's a big shame, and there is no apology anyone can render to the people of Kitui County to accept. For our people are getting maimed, for our people are becoming disabled because of snake bites. As I have explained, it is a problem we are aware of. So the question is, why are we not providing solutions?
Amidst the backdrop of soaring budgets that promise much yet fail to translate into tangible improvements, Alex's words resonate with a poignant truth. The consequences of governance failures and systemic issues rooted in flawed decision-making, misplaced priorities and inefficient resource allocation are all impacting essential service delivery.
I know national government, National Assembly iwezi approve kitu ambayo haiko kwa budget. Tuseme tu inatapeliwa hapa katikati, huyu anakula kidogo, mwingine kidogo, ile mwingine kidogo, na pesa inaisha kama mwananchi hajasaidika. Yeah. Na hiyo sasa hiyo ndio imelewamasha kila kitu kabisa. Unapata hakuna services, hakuna nini, hakuna kitu, na unashindwa sasa hii maneno yote watu watasaidika namna gani?
With the devolution we had a lot of hope in improvement of services, improvement of the workforce, improvement of our community. But we are losing hope because we are prioritizing on building some other things, infrastructures that are not even important directly, instead of improving the lives of the public in this county, improving the lives of the workers in this county.
You've got no business as a government fueling a vehicle to take a chief officer, a director, a county executive committee member home, pick that same officer in the morning, transport them to office, and yet you cannot provide for fuel for a patient to be taken to hospital. I mean, what kind of government are you running? We really know how desperate the situation is. But as we ask the county governments to do better, because they are capable of doing better, I can't defend the county governments on this. There is a lot of laxity which they have to address. The national government needs to rethink their strategy, priorities, and the management of healthcare in this country.
Nancy's story serves as a stark reminder of the consequences that come from a lack of fiscal transparency and accountability in critical sectors. The healthcare system's failure to adequately respond to emergencies like hers underscores the pressing need for better financial management and resource allocation.
How much money are you putting in health? How much money you're putting in agriculture? And I think a lot of money should go into those areas. You know, basically three: health, agriculture, and education. Those are the main three. So as you judge the usage of funds, you must judge them on simply those three, because those are the Chapter 4 elements which are required by the Constitution.
Declining absorption rates, budget cuts and mounting pending bills have dire consequences for countless families across Kenya. Addressing these budgetary deficiencies is crucial for better service delivery and restoring citizen trust in the government's ability to manage resources effectively.
Kenya, we are now living under conditions which are beyond our control, which we really wish we can overcome. So now the question is, how long is this going to go? Yeah. So it's a pill which Kenya is taking. We hope that there has to be change very soon. In other words, the economy, the productive economy must go on.
Money within government is everything when it comes to service delivery. If you do not follow where the money is going, your child will have very, very low quality of education. That hospital where you go and run expecting to have snake antivenom medicine will not have it unless the people you have elected, the people who are in government, know that you care about that and you will hold them accountable. We deserve better. You can get better. Please, we are not beggars. We are citizens. We are the owners of this country.